One of the most gripping illness narratives of epilepsy was documented by Kurt Eichenwald in his autobiography titled A Mind Unraveled. He wrote of how his seizure is set off by his neurons firing in uncontrolled electrical bursts that sweep across his brain. He then said, "My muscles pulled tight as I fell to the floor in what is known as the tonic phase. My jaw closed so strongly that people could hear my teeth crunching even from the next room. A guttural noise from my throat made it sound as if my airway was obstructed. Sometimes I stopped breathing altogether." He then described how the clonic phase follows, saying, "The frenzied electrical impulses commanded my body to jerk." And he likened how he felt on recovery from a convulsion to having just played 10 consecutive games of basketball. He also wrote of how a convulsion impairs his memory, saying, "Whatever else happened before I lost consciousness was lost to the amnesia surrounding a convulsion." He added that while my memory of events before a seizure was always sketchy, sometimes I recalled seeing lights flash in the left side of my visual field. There were also instances when he said the world became amazingly vibrant. Hello, I'm Ibrahim Imam, and welcome to this episode of the Neurology Lounge podcast, where we will start our exploration of epilepsy. Epilepsy is the disease which Eichenwald suffers from, and it is one with a very long history. In their book titled A Disease Once Sacred, E.D. and Bladen reported that the earliest currently known record of epilepsy is contained in the Sakiku, a Babylonian cuneiform medical diagnostic text compiled between 1067 and 1046 BC. Epilepsy was referred to in the Sakiku as antasubba, or the falling disease. But E.D. and Bladen noted that it was not until the 1800s that British neurologist John Hewlings Jackson provided the first scientific depiction of epilepsy. This was when, they said, he began to revolutionize the understanding of the nature and the pathogenesis of epilepsy. Jackson is considered one of the founders of modern neurology, and he joined the National Hospital for Neurology in London at about the same time Jean-Martin Charcot, another founder of neurology, was appointed at the Salpêtrière Hospital in Paris. E.D. and Bladen wrote that Jackson recognized relatively early in his intellectual explorations that epilepsy was a symptom rather than a disease, and he radically considered epilepsy as a temporary disorder of brain function that could be motor, sensory, or mental. Jackson also argued that epilepsy may manifest without convulsions and even without impaired awareness, and that a structural cause may or may not be present. Facts that we still believe today. With this historical context, let us go back to Eichenwald's story, which is very illustrative of epilepsy. The piece I quoted earlier from his book was his description of what he called his grand mal seizures, and these began when he was in college. However, long before he started manifesting grand mal, or more appropriately generalized tonic-clonic convulsions, Eichenwald had experienced recurring episodes of sudden sleepiness from childhood. During these episodes, his voice would break off mid-sentence, he would stare into space, and he would grasp or pick at his shirt. These episodes, previously known as petit seizures, are now more accurately coming under the remit of focal or partial seizures. Partial seizures can be simple, manifesting with only one symptom, or complex, as in Eichenwald's case, where there are many facets to it and where awareness is impaired. Another illustrative depiction of a complex partial seizure is that of Anna, as related by her father Mark Palmieri in the book titled She Danced with Lightning. Anna was just 5 months old when she developed clusters of seizures. Her father wrote that her eyes would avert, her lips would smack, and her right arm would rise and stiffen, and her breath would seem to labor. He said she would then snap back to consciousness for a moment, smile, and then the next seizure would start. From the age of 3 years, he said, her arms would contract and her clenched fist pulled inward with a titan's might. Anna also had writhing and kicking movements. She turned out to have cortical dysplasia as the cause of her seizures. This is an anomaly her father defined as scarred brain tissue that disrupted neurons and leaked electricity until the brain's entire network went afire. She had surgery for this with complete resolution of symptoms. A good ending. Although the classical grand mal and petit mal manifestations of epilepsy are the most recognizable forms of the disorder, they are by far not the only ways seizures manifest. Nor are they the most bizarre. For example, Eichenwald himself went on to develop attacks during which he would drop to the ground, he said, like a ton of bricks. No prizes here. These are appropriately called drop attacks. One example of an even more bizarre manifestation of epilepsy is the ecstatic seizure. A most illustrative example of this was manifested by Dave, a bus driver and patient of neurologist Adam Ziman. Narrating Dave's story in his book titled A Portrait of the Brain, Ziman wrote that Dave's attacks began with a churning in the stomach which left him unnerved. Then, Ziman said, in an instant, David was weightless, an angel on the wing, soaring through a landscape fraught with significance, a sacred text that, for those moments and those only, Dave could read with fluent clarity. He was blessed. The fields, hills, rivers, sky, and the whole valley sang in joyous celebration of the day. Ziman noted that the experience lasted no more than a few seconds, but its intensity was out of all proportion to its length. The panoply of neurological manifestations of seizures is indeed breathtaking, and these range from crying, laughing, singing, whistling, barking, smiling, spitting, kissing, as well as yawning, pouting, nodding, pointing, running, pedaling, dancing, and gyrating. Epilepsy may also manifest with just psychiatric symptoms like illusions, hallucinations, aggression, panic attacks, depersonalization, impulsivity, catatonia, and a very interesting one, telephilia, attraction to televisions. And epilepsy can also manifest with symptoms in other body organs, and these are the so-called systemic features and include heart rhythm disorders, fainting, hyperventilating or hypoventilating, as well as lack of ventilation. Other symptoms include pain, urinary urgency, belching, flatulence, and skin flushing. Another fascinating dimension of epilepsy is when seizures occur in response to an activity or to something in the environment. These are called reflex seizures, and they may occur in response to almost anything you can think about. Exposure to bright light, doing arithmetic, reading, writing, speaking, drawing, playing chess, solving problems, taking a bath, getting into hot water, touching, eating, chewing, toothbrushing, orgasm, listening to music, playing Lego, shadow boxing, and even waving the hand in front of the sun. We can now understand the challenges that doctors face in making the diagnosis of a disorder that can manifest with almost any imaginable and unimaginable symptom. Let's explore this challenge with the anecdote of the famous American composer and pianist George Gershwin, and this was related by physician Colin Grant in his book titled A Smell of Burning. Gershwin was performing with the Los Angeles Symphony in 1937 when Grant said he suffered a near show-stopping moment that was far from scripted. Demonstrating an uncharacteristic lapse of concentration, Grant said the maestro lost his place in the score. At the same time, Gershwin had experienced a nasty smell of burning, which none of the orchestra other than he had detected. Indeed, Gershwin had previously perceived what Grant referred to as a phantom smell, an unpleasant aroma of burning rubber. Furthermore, prior to his 1937 performance, Gershwin had been complaining of inexplicable abdominal complaints as well as excruciating headaches. Grant wrote that Gershwin had consulted physicians in California, but they could find no organic problems, and he was diagnosed with hysteria. Less charitable critics had labeled Gershwin as a hypochondriac. Soon after his dramatic episode in Los Angeles, Grant said Gershwin sank into a coma, and his deteriorating condition led to an urgent search for a neurosurgeon to perform an emergency brain operation, and the suspicion then was that he had a fulminating tumor. Gershwin's case posed several challenges to his doctors, and the first was of making a diagnosis. Because Gershwin did not present with the easily recognized grand mal or petit mal seizures that we have already discussed, it is understandable that his physicians neither associated his phantom smells and abdominal complaints to epilepsy, nor did they link these to his excruciating headaches. Both of Gershwin's symptoms are, however, recognized by neurologists today as classical auras of epilepsy. Auras are very brief seizure symptoms that may stand alone, or they may herald a bigger seizure event. One of the most common seizure auras is the perception of an abnormal smell, as manifested by Grant's own brother, Christopher. Christopher suffered with epilepsy and once asked, "Can you smell the burning?" Grant said that the word aura comes from the Greek word for breeze, and that its typical manifestation as a revolting smell of burning rubber or rubbish figures has been described in many historical records. Grant also referred to William Gowers, one of the earliest neurologists to define epilepsy, who observed that a number of his patients compared the unpleasant sensation to sulfur and to burning putrid meat. Gershwin's story also highlights the variety of disorders that can mimic seizures or epilepsy, making the diagnosis often notoriously difficult to make. In Gershwin's case, his doctors considered the possibilities that his symptoms were the result of hysteria, what we now call functional or non-epileptic or psychogenic seizures. Suffice it to say that Gershwin and his symptoms did not fit the typical profile of functional seizures, a topic which we will address in a future dedicated podcast. Surprisingly, the most frequent mimic of an epileptic seizure is the simple faint, or what we call syncope. This may seem surprising given that faints are common and most people readily recognize when they or others are having a swoon. But faints are anything but neurologically straightforward. To illustrate this, let's look at a 1994 study carried out by Thomas Lempert and colleagues, in which they subjected 59 healthy people to perform a procedure called the fainting lark. In another of his books titled Consciousness, A User's Guide, Adam Ziman defined the fainting lark as a combination of squatting, panting, rising to one's feet, and then bearing down. In his analysis of Lempert's trial, Ziman pointed out that of the 59 healthy people who undertook it, 42 lost consciousness for around 12 seconds and fell. Even more significantly and intriguingly, most of them had convulsive movements about 3 seconds after falling down. These movements lasted about 7 seconds, and occasionally they went on until just after they recovered consciousness. Even more surprising, the subjects who lost consciousness usually had their eyes open and generally rolled up. This is unlike most simple faints where the eyes are shut. And to take things further, the subjects manifested other types of movements 5 seconds into the faint. These included head turning, eye movements, lip smacking, chewing, and fumbling. Typical seizures, you might think. Half of them also made writing movements such as raising their head, sitting up, or standing when silent and amnesic. And Zeman added, most reported some kind of visual or auditory hallucination during the faint. Lempert's study is a graphic illustration of how a fainting spell or syncope can mimic an epileptic seizure. Apart from fainting and functional seizures, other mimics that lead to a misdiagnosis of epilepsy range from transient ischemic attacks, transient global amnesia, migraine, tics, daydreaming, and even panic attacks. And many sleep disorders can mimic seizures, and these include narcolepsy, hypnic jerks or jerks in sleep, parasomnias, which are movements occurring during sleep, periodic leg movements, benign sleep myoclonus, sleep-related auditory hallucinations, and REM sleep behavior disorder in which people are manifesting their dreams physically. And to paint a more complete picture, the list of seizure mimics in children includes staring spells, shuddering attacks, mannerisms, breath-holding spells, reflux, and something called Sandifer syndrome. Let's now go back to Gershwin's story, which turns out to be a veritable can of neurological worms. Gershwin, it turns out, had gone on to display 2 bizarre symptoms which may have aided the misdiagnosis of his epilepsy. On one occasion, he opened the driver's door of a moving car and attempted to push the driver out. And on the other, he crushed a gift of a box of chocolates and proceeded to smear the chocolate all over his body. The cause of Gershwin's brain tumor turned out to be the nastiest of brain tumors, a glioblastoma multiforme. Apart from brain tumors, other brain structural lesions that can cause seizures include stroke, brain injury, brain infections such as meningitis and encephalitis, and collections of blood around the brain. Some others have proposed that Gershwin was at risk of developing his tumor because of his genius. This is not a can of worms I intend to open in this podcast. For today's purpose, Gershwin's case just highlights the need to recognize the diverse ways seizures manifest and the need to search for an underlying cause for them. Reassuringly, however, most people with seizures will turn out to have no structural cause, and they will be said to have idiopathic epilepsy. Idiopathic is a term we medics use when we cannot identify a cause for a problem. What is idiopathic is, however, largely defined by how sensitive the testing technology is. Most seizures indeed have an irritable focus, even if it is too microscopic to be revealed by modern imaging technologies such as CT, MRI, and PET scans. These are technologies we take for granted today, but which we must remember were not even available in Gershwin's time. Apart from brain structural lesions, macroscopic or microscopic, seizures can also arise from diverse systemic medical disorders. These include autoimmune diseases as lupus, alcohol intake and alcohol withdrawal, failure of any organ system, and metabolic impairments such as excessive or low glucose levels. Seizures may also develop from an almost inexhaustible list of medications such as antibiotics and even anti-seizure medications. Gershwin paid the ultimate price for epilepsy because of the malignant cause of his seizures. Death from epilepsy may, however, result as a direct consequence of various accidents and injuries that accompany seizures, and these include burns, drowning, and head trauma. Death may also be the direct consequence of certain sinister seizure phenomena such as refractory epilepsy, status epilepticus, and sudden unexpected death in epilepsy. This is called SUDEP. Beyond the morbidity and mortality of epilepsy is the large beast of the embarrassment and stigma that accompany the disorder. Let's have an insight into these using the experience of Christine Seaborg, and she narrated this in her memoir titled The Sacred Disease. Seaborg's first seizure was at the age of 16 months when she manifested with a sudden change in temperament, and this was associated with a rapidly rising fever. She then experienced what she referred to as my first and most devastating seizure, and this was attributed to infection with influenza. She wrote that my body was simultaneously stiff as a tree trunk while captured by jarring, irregular movements. Seconds bled into minutes that crawled without end into almost an hour of unrelenting convulsing. This is status epilepticus. She did very well on phenobarbital, which was withdrawn after some years. But when she was 14, she said the reset button of borrowed time ran down with the emergence of frequent seizures, which she said start as a sense of eerie familiarity, as if I was reliving something that I had dreamt the night before. This aura, called déjà vu, was then followed by dull thinking, swallowing, lip smacking, and rhythmic hand movements. It was as the seizures increased in frequency and intensity that she said I fostered a growing sense of shame about the embarrassing and unusual behaviors that were beyond my control. To avoid the embarrassment, she said she may hide, turn away, or wander out of view when she sensed an episode coming on. She said she became skilled at fiercely hiding the monster that was gaining strength within, and this worked for her for about 4 years. To explore the various dimensions of the management of epilepsy, I will be speaking in the next episode to Ian Bone, a neurologist and father of somebody with epilepsy, who authored the book titled Sacred Lives. I will then be speaking to Franziska Thomas, author of Fits and Starts, about her long and ongoing struggles with epilepsy. Apart from the books I have already cited, I've also relied on the following sources for this podcast. The first is by Teeve and colleagues, titled The Uncenated Crisis of George Gershwin, published in 2002. The second is by Sloop, titled What Caused George Gershwin's Untimely Death, published in 2001. The third is by Cuiria and colleagues, titled George Gershwin, Genius, Composer, Malignant Brain Tumor Patient. This was published in 2021. And the fourth, by Gacinza and colleagues, is The Unforgettable Neurosurgical Operations of Musicians in the Last Century, published in 2017. Thank you very much for listening to or watching this podcast in which we started exploring epilepsy. If you found it enlightening, you may consider subscribing to NeuroChecklist, my online database, for more of the nitty-gritty of epilepsy. And for the more layperson's perspective, you may consider buying my book called Surfing the Brain. And to make sure you do not miss the next episode of this podcast, why not subscribe to the YouTube, Apple, or Spotify channels? But until then, thank you very much for your time.